Did you know that 37% of medical tests in seniors lead to unnecessary treatments and complications? That's more than 1 in 3. What if the checkups you think are keeping you healthy are actually putting you at risk? Some routine tests recommended after 70 can trigger a cascade of interventions that do more harm than good, leaving patients worse off than when they started. In this video, we're revealing 5 common health checkups that seniors should seriously reconsider after age 70. Backed by scientific studies and real patient experiences, you'll discover why these tests can be risky, what safer alternatives exist, and how to make smarter healthcare decisions. This could save you or a loved one from unnecessary procedures, complications, and reduced quality of life. Welcome to this channel, where we break down important health information you need to know. If you want to make informed decisions about your health, hit that like button and subscribe so you never miss our videos. Now let's dive into these 5 checkups you need to know about. For decades, we've been told that preventative medicine and regular screenings are the keys to living longer. Get your annual checkup, do the tests, catch problems early. It sounds logical, but recent research is revealing a startling truth that challenges everything we thought we knew about senior healthcare. Up to 37% of medical tests performed on seniors lead to unnecessary treatments, complications, or lifelong side effects. Even more concerning, 99% of people over 70 are completely unaware that they may be over-tested. These aren't just statistics on paper. These are real people experiencing real harm from tests that were supposed to help them. The risks go beyond what most people realize. Some tests expose you to dangerous levels of radiation. Others trigger what doctors call a cascade effect, where one test leads to another, then another, each carrying its own risks. A simple screening can snowball into invasive procedures, hospital stays, and complications that change your life forever. Here's what makes this especially troubling. As we age, our bodies naturally change. Not every abnormal test result signals a disease that needs aggressive treatment. A finding that looks concerning on paper might be completely normal for someone your age. But once that result comes back, the medical system often kicks into high gear, whether it's necessary or not. The key is balancing vigilance with wisdom. We need to focus on tests that offer clear, proven benefits, while avoiding those that may cause more harm than good. And that's exactly what we're going to explore today, starting with a test that millions of seniors undergo every year without questioning it. The bone density scan, also called a DEXA scan, measures the strength and density of your bones. It's quick, painless, and primarily used to detect osteoporosis. Doctors frequently recommend it for older adults, especially women, as part of routine preventative care. On the surface, it seems harmless. After all, who wouldn't want to know if their bones are strong? But here's the problem. After age 70, bone loss is a natural part of aging, much like getting wrinkles or gray hair. Most seniors will show some reduction in bone density on these scans, but this doesn't always mean they're actually at risk for fractures. Despite this reality, many are immediately prescribed powerful medications called bisphosphonates, based solely on their scan results. These medications come with serious side effects. Some patients develop jaw necrosis, which is literally the death of bone tissue in the jaw. Others experience severe esophageal irritation, making it painful to eat or swallow. And here's the irony. In some cases, these drugs can actually make bones more brittle over time. So, what does the research actually show? A comprehensive study published in the Journal of the American Geriatric Society followed over 1,200 women over age 70. The results were eye-opening. Bisphosphonate treatment reduced fracture risk by only 0.3% over 5 years. That's 0.3%. Meanwhile, side effects were far more common, including serious digestive issues and the bone problems I just mentioned. Let me share Rose's story. She was a 76-year-old retired piano teacher, active and healthy with no history of falls or bone pain. During a routine checkup, her doctor referred her for a DEXA scan. The scan showed mild bone loss, a condition called osteopenia, which is extremely common in women her age. Based on this finding alone, she was immediately started on medication. Within months, Rose developed severe acid reflux that made eating difficult. Then came the jaw pain. It got so bad that she had to stop playing piano, something she'd done her entire life. The woman who came in healthy was now dealing with multiple complications from a medication she probably didn't need in the first place. Rose eventually stopped the medication and switched to a different approach. She started taking vitamin D supplements, began doing weight-bearing exercises, and adjusted her diet to include more calcium-rich foods. She regained her strength, the side effects disappeared, and she never experienced a single fracture. And Rose's approach is actually backed by solid science. 2022 study in Osteoporosis International found that strength training, balance exercises, proper nutrition, and treating vitamin D deficiency can reduce fracture risk by over 20%. That's significantly better than the 0.3% we saw with medication, and without any of the dangerous side effects. So if you're over 70 and not experiencing falls or fractures, lifestyle interventions are far more effective and safer than rushing into medication based on a scan result. Your bones might look different on a test, but that doesn't automatically mean you need pharmaceutical intervention. Now let's talk about something that terrifies many older adults: memory loss. It's completely normal to occasionally forget where you put your keys or struggle to remember someone's name, but the fear of dementia often drives seniors to request brain MRIs, hoping to catch problems early. These scans provide incredibly detailed images of your brain's structure. They seem like a good idea, right? The problem is that in seniors, brain MRIs almost always reveal age-related changes that look concerning but are actually not dangerous at all. Most MRIs performed on people over 70 show things like slight brain shrinkage or white matter spots. These findings are completely normal for this age group. Your brain at 75 naturally looks different than it did at 45. But when these results come back, they often trigger anxiety, more testing, and sometimes even invasive procedures like spinal taps or brain biopsies. The evidence on this is clear. A 2021 study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints, the kind of forgetfulness we all experience as we age. Here's what they found. 86% of the scans showed some abnormality. That sounds alarming until you learn the next part. Only 3% were actually linked to treatable conditions. That means the vast majority of these patients underwent emotional distress, anxiety about dementia, and unnecessary follow-up tests, all for findings that were simply part of normal aging. Imagine being told there are spots on your brain or that your brain has shrunk. Even if it's normal, those words stay with you. George's story illustrates this perfectly. He was a 74-year-old retired engineer who started worrying about occasional forgetfulness. His doctor sent him for an MRI, and the scan showed white matter changes. George was convinced he had dementia. He withdrew from his hobbies, stopped seeing friends, and became increasingly anxious and depressed. His family finally insisted he see a specialist who performed standard cognitive testing. The results? George's memory was completely normal for his age. The white matter changes on his MRI were expected findings for a man in his 70s. With some simple lifestyle adjustments, better sleep, proper hydration, and brain-stimulating activities like puzzles and reading, his memory actually stabilized and he regained his confidence. George spent months believing he was losing his mind, all because of a scan that showed normal age-related changes. Unless you're experiencing severe neurological symptoms like seizures, sudden personality changes, or rapid cognitive decline, an MRI is rarely helpful for mild memory concerns. A simple cognitive screening test administered in your doctor's office is a much safer and more effective first step. Moving on to our third checkup, let's discuss cardiac stress tests. These tests monitor your heart while you exercise on a treadmill or receive medication that simulates exercise. The goal is to spot blocked arteries that could lead to heart attacks. Doctors commonly order these tests for seniors who mention mild fatigue or occasional chest tightness. But here's where things get problematic. In adults over 70, the false positive rate for stress tests can be as high as 40%. That means 4 out of every 10 people are told they have heart problems when they actually don't. And once you're labeled as having a potential heart issue, the medical cascade begins. A concerning stress test typically leads to an angiogram, where dyes and catheters are inserted into your arteries. From there, doctors often recommend procedures like stent placement or even bypass surgery. These are serious interventions with real risks: bleeding, kidney damage from contrast dyes, infections, and extended hospital stays. The research on this is sobering. A 2017 study published in JAMA Cardiology examined thousands of cases and found that more than half of stents placed after stress test referrals were in patients with no real symptoms or benefit. These patients saw no improvement in survival rates or quality of life, but they experienced significantly higher rates of bleeding, kidney injury, and prolonged hospitalizations. Raymond's experience exemplifies this problem. He was a 75-year-old retired postman who mentioned feeling mildly fatigued during a routine checkup. His doctor ordered a stress test, which came back abnormal. This led to a cardiac catheterization where they found a minor narrowing in one artery. Even though Raymond had no chest pain and could walk several miles without issue, they placed a stent. During the procedure, Raymond had a reaction to the contrast eye. His kidneys began to fail, and he spent 6 days in the hospital undergoing treatment. When he finally recovered and went home, his fatigue persisted. It turned out his tiredness had nothing to do with his heart. He was simply not sleeping well and had mild anemia. The entire ordeal, with all its risks and complications, had been unnecessary. If you're over 70 and not experiencing classic cardiac symptoms, chest pain during physical activity, significant shortness of breath, or a dramatic drop in energy levels, a stress test may be completely unnecessary. Safer alternatives exist, like a simple resting EKG or a coronary calcium scan, both of which carry far fewer risks and can provide valuable information when symptoms actually warrant investigation. Now let's talk about colonoscopies. This procedure uses a camera on a flexible tube to examine your colon for cancer or precancerous polyps. It's been a standard screening tool for decades, and it has saved lives. But the risks of colonoscopy increase significantly with age, and for seniors over 70, the risk-benefit calculation changes dramatically. The preparation alone carries risks. You have to drink strong laxatives that clear out your entire digestive system. For older adults, this can cause severe dehydration and kidney problems. Then there's the sedation required for the procedure, which can affect brain function in seniors. And the procedure itself carries risks: bleeding, bowel perforation, and heart rhythm disturbances. Let's look at what the data actually shows. A comprehensive 2019 study, published in JAMA Internal Medicine, followed over 1.3 million Medicare patients aged 70 and older. The findings were striking. For every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved. But more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio, and not in the direction you want. Dana's story brings these statistics to life. She was a 73-year-old grandmother with no symptoms and no family history of colon cancer, but her doctor urged her to get a screening colonoscopy. During the procedure, they removed a small polyp. It seemed routine, but Dana suffered a bowel perforation, a tear in her colon wall. She spent 9 days in the hospital recovering. She lost significant weight and took months to feel like herself again. And here's the thing, Dana had already had 2 previous colonoscopies that came back clean. Given her history and lack of risk factors, this repeat test was almost certainly unnecessary, and it resulted in a serious complication that dramatically impacted her quality of life. The U.S. Preventive Services Task Force, which sets screening guidelines, now recommends stopping routine colon cancer screening at age 75 for most people. If you're in excellent health and want to continue screening, a stool-based test like the FIT test is a much safer, non-invasive alternative. You do it at home, mail it to a lab, and it can detect signs of cancer without any of the risks associated with colonoscopy. And now we come to the most dangerous checkup on our list: annual full-body CT scans. These are aggressively marketed as a way to catch cancer early, often included in executive health packages or preventative care programs aimed at seniors. They sound appealing. Who wouldn't want to detect cancer before symptoms appear? But the reality is far different from the marketing. Each full-body CT scan delivers radiation equivalent to 500 chest X-rays. Let that sink in. 500 chest X-rays in a single scan. And if you're getting these annually, that radiation exposure accumulates year after year. The numbers are genuinely shocking. A 2023 modeling study published in JAMA Internal Medicine found that the dramatic rise in CT scans over the past few decades may now be responsible for up to 5% of all cancers diagnosed in the United States. That's on par with daily alcohol consumption as a cancer risk factor. The very test being promoted to prevent cancer may actually be causing it. But the radiation is only part of the problem. CT scans are incredibly sensitive. They detect every tiny abnormality in your body. And as we age, our bodies accumulate harmless nodules, cysts, and other findings that are simply part of getting older. Once these findings are flagged, however, the medical system treats them as potential threats. What follows is a cascade of additional scans, biopsies, and sometimes even surgeries, each carrying significant risks. Most of these findings turn out to be completely benign, but by the time you discover that, you've already been exposed to more radiation, undergone invasive procedures, and experienced complications that may have lasting effects. Marcus's experience is a perfect example. He was an active 80-year-old man who underwent a full-body CT scan as part of what was marketed as a comprehensive senior health checkup. The scan found a tiny nodule in his lung, just a few millimeters in size. Immediately, he was referred to oncology, underwent a PET scan for more radiation, and was scheduled for a needle biopsy. The biopsy revealed the nodule was benign, just a harmless collection of cells. But during the biopsy, part of Marcus's lung collapsed. He was hospitalized immediately and spent 2 months recovering. An active, healthy 80-year-old man was reduced to struggling for breath and unable to do the activities he loved, all because of a finding that posed no threat whatsoever. Medical experts across the board advise against full-body CT scans for general screening in people without symptoms.
Targeted imaging is appropriate only when specific symptoms warrant it. Unexplained weight loss, coughing up blood, visible swelling or lumps, or other clear signs that something is wrong. For asymptomatic adults, especially seniors, these scans create far more problems than they solve. So how do you protect yourself from unnecessary testing? It starts with asking the right questions before agreeing to any medical test. The most powerful question you can ask your doctor is simple. What happens if this test finds something? This question forces a real conversation about the next steps. Will an abnormal result lead to more testing? Will it lead to treatment? What are the risks of that treatment? Often doctors order tests out of habit or because it's protocol, without fully considering whether the results will actually change your care or improve your quality of life. Here are the essential questions you should ask before any test. First, what are the actual risks and benefits of this test? Make your doctor give you specific numbers, not vague statements. A 0.3% benefit sounds very different from, it could help, doesn't it? Second, are there safer alternatives? Could you start with a less invasive test or simply monitor symptoms? Third, will the results change my treatment or improve my quality of life? If the answer is no, or if your doctor seems uncertain, that's a red flag. And finally, what happens if I choose not to do this test? Sometimes the answer is that nothing bad happens at all. If the answers to these questions are unclear or if the risks clearly outweigh the potential rewards, it may be time to pause and reconsider. You have the right to decline testing, and a good doctor will respect your informed decision. Here's something else to consider. The most effective way to protect your health after 70 isn't through endless testing. It's through proven lifestyle choices that have a far greater impact on longevity and well-being than most routine screenings. Stay physically active with regular exercise. This doesn't mean running marathons. Simple activities like walking, swimming, or strength training a few times a week can dramatically reduce your risk of falls, heart disease, and cognitive decline. Eat a balanced, nutrient-rich diet focused on whole foods, vegetables, fruits, lean proteins, and healthy fats. Your diet has a profound impact on everything from your immune system to your brain health. Get enough quality sleep. Sleep deprivation is linked to nearly every chronic disease, and it becomes even more important as we age. Maintain social connections and stay engaged with your community. Loneliness and isolation are as harmful to health as smoking 15 cigarettes a day, according to research. And finally, treat vitamin deficiencies, especially vitamin D and B12, which are common in seniors and can affect everything from bone health to cognitive function. These 5 lifestyle pillars have a greater impact on how long and how well you live than any screening test. They address the root causes of disease rather than just looking for problems after they develop. Modern medicine has given us incredible tools and capabilities. We can see inside the body with remarkable detail. We can detect abnormalities that would have been invisible a generation ago. But more technology doesn't always mean better care, especially for seniors. The risks of over-testing are real, serious, and often underappreciated by both doctors and patients. For people over 70, the focus should shift from aggressive screening to individualized care. What makes sense for a healthy 50-year-old may not make sense for you. Your medical history, your current health status, your life expectancy, and your personal goals all matter. Cookie-cutter protocols that apply the same tests to everyone regardless of age or circumstance often do more harm than good. By asking the right questions, understanding the real risks and benefits, and prioritizing lifestyle over testing, you can avoid unnecessary procedures and enjoy a healthier, more vibrant life.
Your time, energy, and health are too valuable to waste on fear-driven screening that offers minimal benefit. If you or a loved one has experienced complications from a medical test or treatment that turned out to be unnecessary, you're not alone. Sharing these stories helps others make informed choices and advocate for smarter, safer healthcare. Leave a comment below if you'd like to share your experience. Remember, prevention doesn't start in a doctor's office with a test. It starts with how you live each day. Choose your checkups wisely, ask questions, and don't be afraid to say no when the risks outweigh the benefits. If you found this video helpful, please share it with friends or family members who might benefit from this information. Hit that like button and make sure you're subscribed to this channel so you don't miss our upcoming videos on making informed health decisions. Your health is in your hands, and knowledge is the first step to taking control.